Malawi, access to accurate sexual and reproductive health information and services remains a major challenge for many young people, especially in rural communities. For young people living in villages around traditional authority Kalumbu in Lilongwe, Nyanja Health Facility was an important source of youth-friendly sexual and reproductive health services. But in 2024, the facility was forced to temporarily close its youth-friendly section due to supply shortages and operational challenges. Determined to restore services, Jamiko Mbetewa, a Zatu brand ambassador in the area, who received training in advocacy, communication and leadership from the iHEARD project, led an advocacy campaign with support from the Lilongwe Youth-Friendly Health Coordinator and the Ministry of Health. What challenges were the youth facing when the services were curtailed?
The main challenge was that some young people were not able to access the services. That was a big challenge because the health center was closed and there were nowhere else to get the services. For example, maybe they want some condoms, they need to get tested for HIV.
What really motivated Jamiko?
What really motivated me is that there was a training, and this training it was hosted by the FRI, Farm Radio International. In this training, it focuses much on advocacy. After being trained, I gained confidence and I get some skills on how to advocate. That's why I came here, see the challenges that my fellow youth are facing. It motivates me to take an action.
Thomas Moses is one of the youths who appreciates the reopening of the youth-friendly services.
Chitsogera ya youth-friendly health services chimene chalithandiza kwambiri achinyamata pano tiliozindikira kwambiri. Komanso mimba zacheperapo chifukwa timabwera zatenga chani kuti njeza kulazo. Kubwera kwa iHEARD tadziwa maufulu amene ife tikhoza kuyenera kuchita, maufulu ogonana. Tinako ufulu monga ife anyamata kupita kuchipatala kukatenga njira zakulera. Pamene tikupanga zija maufulu akuchipatalaja tikuyenanso kuti ife monga achinyamata tikhale ndinakuthekera kunena kuti tikhoza kuchita zinthu monga kudzimira ngati ife patokha achinyamata. Kupanga mabizinesi kapena kupanga mapoga mwina ndiyena kusana ndi zaulimizi.
Master Sakonda, one of the youth-friendly service providers at the health facility, says even traditional leaders are happy with the development.
Mizimu anthu akumazilandira kwambiri, ngakhale mafumu akumazilandira. Zopangitsa kuti mizimu school izipita chitsogolo. Mafumu sonawonso akhawa osangala chifukwa chokuti azizimayiwa kapena achitsikana sakumatenga mimba. Zimene zipangitsa kuti ngati kumbali ya school ikupita chitsogolo, nawo mafumu akumakhala osangalala kwambiri.
Zatu, which is now under the National Youth Council, is supporting youth clubs.
So basically the support that we provided to youth clubs, because we work with youth clubs, is to ensure that they are provided with trainings. So we do provide these trainings, but also provide materials to keep them going, to ensure that when they meet, they're doing the radio listening sessions, they understand what is being communicated to them. So more or less like empowering them with not just information, but also with skills on how they can continue to do activities within their clubs.
The lesson is clear. When young people, such as Jamiko, gain the skills, confidence, and platforms to participate meaningfully, their influence extends beyond individual behavior change. They can identify barriers, negotiate solutions, and help build stronger, more responsive community health systems.